Well, before we get into the program, a little bit more about Arrowhead Regional Medical Center. Now, I understand that Arrowhead is designated as a level 2 trauma center,
Correct.
and you guys also operate a regional burn center?
Correct. Yes. Yes. We have people. Sometimes I've had patients from like across state lines with burns. We are one of the few areas who deals with acute care for burns, and we're a level 2 trauma center. So we see car accidents, you name it, anything, and they're flown to us from up in the mountains, from the local area, from wherever.
Right, right. And when we were talking a little earlier too, I had mentioned that I went out to the emergency medical
Oh, we had an emergency
response
yeah, EMS
conference.
day, yeah. We had providers from all around the community, the fire paramedics, we had all the different helicopter services, Mercy Air, and a few others come, and we had our sheriff's department and our SWAT team and the police force in the surrounding area all come, and you learn about the different aspects of everyone's first response, because there are our eyes and our help all in the field. So they taught us about, they took apart a car and showed us the jaws of life and all those sorts of things. And yeah, and it was very interesting to hear about just the first response before the patients even get to our hospital, what they do. And we're very grateful every day for what they do in the community.
Yeah, I was amused. I was like, I'm a 50-year-old man, but I was amused with everything going on that day. That I was like a little 5-year-old kid. Like I want to be a fireman.
It was
then
very cool.
Saw that big, what is it? That big helicopter.
Yeah,
that
the Los Angeles County Sheriff's brought out their Super Puma and their helicopter guys, their paramedics came out, and it was pretty cool.
Yeah, it was awesome. I was just like in awe. I was just like, wow, look at that coming in, and I mean, it was just amazing. And thank you all for the work that you do, and in emergency services. I mean, you guys. I mean, I know you get into this business, because you have a caring heart, and you want to help others, and what other way to do it by doing what you do? That's crazy. That's crazy. But anyways, so I don't want to steer away. I just wanted to mention a little bit about that. But tell me a little bit about the residency, the research day.
So Arrowhead has a number, like my wife said, has a number of residency programs or specialty training programs for doctors, and a lot of the doctors participate in research projects that they come up with and studies they want to look, either things that we do like where we kind of plan a study and follow it through, or we look at some data that we may have at the hospital and we analyze the data and see how we can improve healthcare within our own hospital system, within the national hospital system, and then most importantly within our own community. So I think we had around 55 different
original research
projects or papers that were presented this year. And some people present original research, and some people just they come up with a poster or presentation about something interesting or unusual that they may have seen and taken care of an unusual patient, because Arrowhead does actually have a lot of really interesting stuff for a big hospital, like my wife says, and we see a lot of interesting cases and
something for everyone to learn from,
yeah.
So we can all be better prepared to treat our patients. So that's kind of a part of the goal, is coming up with an idea, seeing if it can better our community, seeing what's out there and how we can better treat everyone. And then we follow the scientific processes at a local level, and then it goes all the way up to national levels as research. And it's excellent that we got to take part in it as residents.
Right. And I'm a TV watcher, so you gotta excuse me. But always watching Cops, and then I'm also always watching, is it emergency room traumas or program? Yeah, and it just amazed me. You get these patients that go into a medical center, and they might be screaming off the top of their head, or they might be vomiting for some unknown reason. And it's amazing how the doctors will get together, and you guys start looking at what could it be, physical, their blood, their I mean, I don't know all the terminology, but so help me out here a little bit.
it's pretty awesome that like a lot of what we do comes down to research that's been done in the past. So someone comes in screaming off their head or something like that, they're different, the family's really concerned they're different. Well, there's research that tells us certain tests to order and why we're gonna get those tests, and it's been studied that, you know, it could be this, they could have an infection, and why am I gonna get these tests? So it's you know, it all comes back to what has been studied in the past, and that's become general practice. And so we have a method and a way to approach everybody because of that, and so we know what to do and how to better treat our patients.
And another big reason that we do research is for collaboration. Like my wife is an emergency medicine physician. I'm an internal medicine physician. These are two very different fields of medicine, but we work very closely together. You know, you have that patient who comes in super sick, you know, basically dying, and we work together. The ER will come in, they'll assess the patient, get them stabilized, and then, you know, the medicine team will come on board and help get the patient, you know, figure out what's wrong, you know, get their care plan figured out, and get them better, and get them healthy, get them upstairs, you know, take care of them. So a lot of the research